Global Partners for Development proudly presents What Do You Understand? A deep dive into the many facets of philanthropy and development. We will have conversations about what really works and what really doesn't. Do we know yet how to solve poverty? Are big ideas the answer, or do we need to look for small, grassroots solutions? Experts in their field will discuss an aspect of their work that they understand particularly well. We will delve into how their work addresses global inequity with an honest conversation about impact. Let's talk about big bets, innovation, social enterprises, large-scale humanitarian aid, and the fixation on ending things, or solving humanity's greatest problems, and the issues that arise while tackling it all. I am your host, Rhea Pullen, and my co-host is the Executive Director of Global Partners for Development, Daniel Casanova. Our guest today is Barry Levy. He is a physician and epidemiologist and an adjunct professor of public health at Tufts University's School of Medicine. He has written and spoken extensively about the health impacts of war. He wrote the book From Horror to Hope, Recognizing and Preventing the Health Impacts of War, which was recently published by Oxford University Press. Dr. Levy is a past president of the American Public Health Association and a recipient of the Sedgwick Memorial Medal, its highest award. Dr. Levy, thank you so much for joining us.
Great to be with you and your listeners today.
Yeah, thanks. Good to have you.
Yeah, and kind of like this is what a time for you, having a global pandemic at the same time. Like you said, there are wars going on, but one so heavily publicized. I would assume a lot of people are coming to you for your expertise in handling not only the epidemiological side of it, but also, the impacts that are going on currently in Ukraine. Could you speak a little bit to the current status of the last couple of years?
Yeah. Well, let me focus in particular on the Ukraine war, which
Sure.
Russia's war in Ukraine, which began on February 24th. So we're looking at 3.5, 4 months of war there, and several things to point out. One is, and these are obvious, but I just wanted to focus on them. What I see as important aspects of this war. Obviously, there have been widespread attacks on civilians and civilian infrastructure, and it's not just hospitals and health workers, but it's the food distribution system. Russia has been bombing grain storehouses, and they've been stealing wheat and laying landmines in the ground that make it impossible for the farmers to grow. So widespread attacks on civilians and civilian infrastructure with massive violation of human rights and international humanitarian law. The second thing is that the huge amount of displacement, and this has of course been widely publicized. Roughly a little more than a third of the whole Ukrainian population has been displaced from their homes and communities.
Wow.
Roughly half, a little less than half, about 6 million in other countries like Poland and Hungary and Romania, and about 8 million who are internally displaced. And these people are in some ways worse off than the refugees who have made it to relatively safe havens in other countries. So these are people who are uprooted with their own country. There's a war going on. Their food and water is restricted. They basically have little or no medical care. The physicians in the clinics are, of course, appropriately focusing on the people who are wounded and whose lives are threatened from the fighting. And so the second issue is displacement. And then the third number is, third point I want to make is that in addition to the people who have obviously been injured, and of course many of them killed by these attacks from bombs and bullets and these cluster munitions and so forth, is the probably much larger number of people who are dying or becoming ill as a result of damage to the infrastructure. So again, that's hospitals, clinics, food distribution, water systems, but also the electrical grid. I mean, think of people who were on dialysis, who depend on the electricity functioning, and then transportation, getting to
refrigeration for medicines, or
refrigeration. I mean, just to keep food safe, refrigeration, and communication. I mean, people are cut off from the internet. They don't know. Many of them are hiding out in basements or maybe in the forest without internet connections and other forms of communication. So it's the impact of all these indirect effects is probably much greater than the direct effects, and as widespread as the direct. And in fact, if you look at wars between, I think it's 1990 through 2017, if you look at two sets of data, I won't go into the details here, but if you look at two sets of data for that almost 30-year period, the number of indirect deaths during wars, and many, many wars during that period of time, over 1,000 wars during that period of time. If you look at those data, the number of indirect deaths may be as high as 20-fold greater than the number of direct deaths. And it's probably not 20-fold.
My goodness.
Maybe even if it's just double, it opens your eyes to the fact that, on the one hand, it's clearly a war crime when a Russian soldier blindfolds and takes ties up somebody and shoots them in the head. Clearly, that's a violation of international humanitarian law, which was supposed to protect civilians during war. But when the infrastructure is destroyed and people are dying of starvation, are dying of contaminated water because they're drinking the only available water and it may be contaminated, and they can't get medical care, or they run out of medicines, and people with hypertension get a heart attack or a stroke because their blood pressure is not controlled. That doesn't show up in any, study. In fact, it may be even hard to identify those people, those deaths and those illnesses after the war is over. So that's an important aspect of what's going on.
Right, and those humanitarian borders that are, being attacked, when those humanitarian borders are specifically for getting in supplies that need to come in that they can't produce on their own, they are within the country. What is the impact of that if not having the ways to get humanitarian aid into the places that need it?
Oh, it's causing widespread death and illness. Absolutely. Not only that, and you refer to the corridors, not only to get the aid in, but for the people who want to leave, there have not been safe corridors to leave. And so many people, in fact, have been killed or injured while attempting to leave because the Russians have fired on them. So, I mean, it's hard to find words that describes the enormity of the humanitarian catastrophe that is occurring as a result of Russia's war of aggression here.
So I'd just be curious to hear about, in however form you want to talk about it, how you came to get involved in public health. Sure. And I assume that's, in track of being an MD, but I'm just curious your narrative for the teleology of your life.
I think it was Soren Kierkegaard, the philosopher, once said, life can only be understood backwards, looking backwards, but it must be lived forwards. So I could look back, and it's true for, I think, many people, you look back on your life and you can, define various periods or phases, but, the reality is you take one step at a time, and you take opportunities as they come up. And some people have compared life to improv, that unscripted theater, that is, one thing leads to the next, and before you know it, you're in my 70s and looking back, and I can see patterns that I may not have seen, living forward. So for me, I always wanted to be a doctor, and but I was also interested in preventive medicine and the broader sociological, societal impact of medicine and health and public health. Early on in my career, I had several experiences in public health that really pointed me more in that direction for a major part of my career. And by the way, I've also spent a considerable part of my career working in occupational and environmental medicine on the diagnosis, treatment, and prevention of work-related diseases and environmentally related diseases. But so, I mean, preventive medicine and public health go hand in hand. And early in my career, there were three things that happened that pushed me more in the direction of public health. One is I had two summer experiences, both of them, by the way, in California, one in a community setting and one in an epidemiology training program, which were wonderful experiences, and it kind of opened my eyes to not only the problems of public health, but what you could do from an epidemiological point of view to characterize those problems and to see opportunities for prevention. Second thing that's happened is I took off a year between my third and fourth years of medical school to study public health. And so I left my medical school, Cornell Medical School in New York City, went up to the Harvard School of Public Health for a year and got a master's degree in public health. And I learned as much from the courses as I did from my classmates, many of whom were well advanced in their careers. I mean, one of them was deputy director of the Centers for Disease Control.
Oh,
And
wow.
many had experiences not only in the United States, but many other countries. And so it was really a wonderful experience and really opened my eyes to public health. And then the third thing is I spent 3 years with the Epidemic Intelligence Service, the so-called EIS of the Centers for Disease Control. Those are so-called shoe leather epidemiologists who go out and investigate COVID or investigate some waterborne disease or a variety of other things, not limited to infectious diseases. And in fact, some of the most interesting experiences I had to do with exposure to asbestos in city water in Duluth, Minnesota, and a lead smelter in St. Paul that was exposing not only the workers, but indirectly their children because they were bringing lead home on their work clothes. So it was those experiences that pointed me in the direction of public health, but always spending a fair amount of my time in clinical medicine. And when I had my first position after my training, I was at the University of Massachusetts Medical School, where I was asked to set up a program in occupational environmental medicine. As I said a moment ago, that involves not only diagnosis and treatment of work-related diseases, but also prevention. And so an important part of what we did was outreach to companies, labor unions in central Massachusetts to see what we could do, not only to help address existing problems and to study them epidemiologically, but also to help them to prevent further cases of work-related diseases and injuries. So with regard to war, though, and again, one's career evolves in interesting ways. So I mean, I've always had an interest and spent a lot of my work in occupational and environmental medicine to this day. But in 1980, I had the opportunity to work in a Cambodian refugee camp, and I did for 2 months in Thailand.
Where and where were you? Where in Cambodia?
It was near a town called Aranyapathet in Thailand. These were over 100,000 Cambodian refugees who crossed the border a few months before and were in this camp that they helped to build with supplies from aid agencies in the UN. There were over 100,000 of them. And I was part of a team from the International Rescue Committee and Cornell Medical School that went over there. And we went over there in 2 to 4 month periods. I was there for 2 months. And so there are overlapping groups of mainly physicians and medical students, but also nurses and nursing students and some others who participated running what in effect was the emergency ward in the camp. But we also did a number of outreach activities to track disease within the camp and also to train workers, many of whom were doctors and nurses back in Cambodia, but train them in public health so they actually made up the public health department within the camp. So it was an eye-opening experience for me, who had never been in a situation related to genocide or war, and this really was both in a sense. The people in the camp were survivors of the Cambodian genocide, where probably 1.5 million of 7 million people in Cambodia between 1975 and 1979 either died or were killed by the Pol Pot regime. And the people in the camp were the survivors, many of whom had lost many family members. They had lost their communities. Many of them were malnourished or had chronic diseases that were untreated for several years. And so it was an eye-opening experience, not only to learn from a medical or public health point of view, but to also see the impact of genocide and war on these people, and also their tremendous resilience, having gone through that, their motivation to go on. I mean, a lot of people would have given up, at that point. And so it was really an eye-opening experience, and one that began my interest in the impact of war and genocide.
Yeah, in terms from a public health perspective, right? Yeah,
absolutely. And in medical and nursing schools, but even more notably in schools of public health, there is relatively little courses or even elective courses on war and terrorism, and particularly since war is such a major public health problem on a global basis,
Yeah.
And it's taken a lot of people in this country to recognize that there's still war going on because of the war in Ukraine. I mean, it's unavoidable now, but if you go back a year, there were, and there still are, about 40 other wars being fought in the world. They're in places like Yemen and South Sudan and other places that are hard for even myself sometimes to find on a map. And so these are wars that are going on where civilians are attacked, where women are raped, where men are abducted in the middle of the night, never to return. There
Yeah.
were attacks on hospitals and clinics and health workers. And this is going on. It's still going on, but it's taken the war in Ukraine to make it front and and center
Right.
with this 24/7 news coverage that enables everybody to see what's going on. So,
Yeah. Well, so the one thing I'd be curious to know is, so uh, in your book, you talk about documenting war crimes as a means for mitigating the impacts of, public health on populations affected by war. I'd be curious your thoughts in the comparison, because you talked about Yemen and Sudan, and I used to always tell people pre-Ukraine war, I'm like, there are these places that are like hell on earth where people have to go about their day-to-day lives, and it's right, like it's there, it's Syria, it's Yemen, it's these places that no one cares about. And I think that when I watch some of the current trials right now that Ukraine's doing on Russian soldiers, I think, okay, this is getting documented. And because there's so much media in Ukraine, but I'm curious, like, I don't think that's happening in Yemen or in Syria or in Sudan at the same extent. And it might be longer played out, like what happened with Rwanda, but I'm just curious if your thoughts and how that's playing out right now.
yeah, uh, it's an important thing to be done. That is to document the war crimes. And I was just alluding to the fact that the direct war crimes. Well, first of all, the war itself, as a war of aggression, violates international humanitarian law. But the cruel and inhuman punishment, the torture that's occurring, that people have been killed, as a result of these violations, that needs to be documented. And no one expects that every single act is going to be documented, but it's important to document as many as possible, both by interviewing people during and after the war, but also by forensic examinations, which means examining people who may have been tortured to find physical evidence to document that, and sometimes even digging up the remains of people to document torture or inhuman punishment. Now, that's far from complete, but it's a step in the direction of ultimately holding people accountable. And that's been a major issue, is that people have not been held accountable at all levels. I mean, and often it's, if anyone gets punished, it's the people low down on the organization chart. It's not the leaders who start the war in the first place. So all that's vitally important to document it. One of the people who I highlight in the book in a profile is a man named Vincent Jacopino. Actually lives in Southern California now, and he has worked for many years in supporting torture victims, in both supporting them physically, but also psychologically, and also helping them, you might say, legally to gain, entrance into, say, the United States, being under asylum laws and so forth. And in the course of his work over many years, he developed systematic procedures for documenting war crimes, basically forensic examinations.
Yeah.
And several years ago, working with the UN and many international partners, they developed a book that systematically identify the kinds of examinations in a standardized way that need to be done to document war crimes, to do forensic investigations. They've now come out with a second edition of that book, building on their earlier work. It's called the Istanbul Protocol, and it's done together with the United Nations. But that's very important work to begin to gather the evidence to hold people accountable, because unless that's done, people will continue to do these war crimes with impunity.
Well, we can hold everyone accountable but the US. We just don't want to hold the US government accountable, right?
Well, so
the US
actually,
doesn't want to participate, though, in that way. Yeah.
Well,
Yeah.
there are problems indeed.
Yeah.
5 days before the war began, this war, I think the day was February 19th, I participated in a webinar that was sponsored by the International Physicians for the Prevention of Nuclear War. And I said to myself in preparing that talk, I said, well, when before has a major superpower invaded a low or middle income country? And there are many instances, but the instance that came to mind was the Iraq War in 2003, when the United States, you could say, conducted a war of aggression. Now, we had we had reasons to think why we should invade Iraq, but nevertheless, there appeared to be emerging parallels between what happened in that war and what might happen in Ukraine. And so, I talked about what could happen. Now, I think there's an important distinction between what happened in that war, as bad as that war was, and the untold numbers of illnesses, injuries, and many, many deaths, hundreds of thousands of deaths, is that in that war, I think it's fair to say that our military does the best it can, often under difficult circumstances, to try to avoid killing and injuring civilians. Now, there are many times where accidentally or unavoidably, you might say, civilians have been killed and injured. It's not to absolve the United States. But the major difference in this war is that the Russian military is directly going at civilians. Mm-hmm. They're, people use the term industrial scale. I mean, the scale of this is hard to imagine, but they're killing, tens of thousands of people directly, and heaven knows how many people indirectly in the ways I already mentioned. So I think that's an important distinction between the way our military functions, and I have high respect for our military, and the way that the Russian military is apparently going about this war.
That's fascinating. Another thing you spoke to that kind of spoke to me, especially my mama heart, is all of the unseen injuries, some things that go internally, whether it be trauma, and the thing that speaks to my mama heart are the children who are either fleeing or still there or have seen so much loss. Or even you talked about, the babies in utero, like what happens with the babies when they're born, just like the physical effects of just the stress put on the mothers. So the things that you said about, could you speak a little bit more to the unseen physical injuries? We can, track a lot of the wounded, the tortured, all of that, but the ones who have the long lasting non-physical effects. Could you speak to that a little bit?
Yeah. So let me comment on one physical effect first, and then talk about the non-physical and some of which are mental health and psychosocial. But it's important to understand that malnutrition is not, which no doubt is happening, and maybe it's going to vary from different parts of this huge country. Ukraine is the size of Texas with the population of California, so it's a huge country, and some 40 plus million people before the war began, and so. The situation is different in different parts of the country, but in some parts of the country, no doubt, there's wide-scale malnutrition, and it's primarily affecting children, but also pregnant women, lactating women, older people, vulnerable populations. But the effects on children are not only lack of food, but the impact on their physical growth and on their mental development. And they will have, no doubt, some degree of cognitive, impairment as their lives go on. So, and the other thing that's increasingly been recognized over the last 30 years or so is that nutritional deprivation early in life and in utero may have effects later in life in terms of increasing the risk of cardiovascular disease and other non-communicable chronic diseases. Wow. And there's increasing evidence for that. So there are many, as you say, many invisible effects. And then the mental health effects are profound. I mean, we talk about appropriately, these horrendous school shootings, the school shootings that have gone on and mass killings in the United States, and children who have been killed and injured and then witnessed that, and even the children who have not been in the same classroom and maybe not even the same school, but the effects on their mental health now and in the future. Now consider the war that's going on in Ukraine, and by the way, the wars that are going on in 40 other countries, and the impact that that's having on children's lives, not only affecting them, but the effects that will have in turn on their own children down the line. So I mean, the effects are profound on mental health, on cognitive development, on psychosocial well-being, and these are hard things to repair. I know we spoke a little bit before the session about how development takes years and years and years to and a lot of hard work and coordination to move forward and make progress, and one step at a time. And literally in minutes, all that can be shattered and destroyed in a war. And so yes, indeed, the impact on children is profound.
Yeah, interesting. Well, I mean, going on that, I mean, I know we were gonna. I know that you did work in Nairobi for a little bit.
Yes.
And before this, we had touched maybe on thinking about like what role development in terms of public health measures or development in terms of international aid, what kind of impact, what correlation that has with public health and war. And
Yeah.
I'd be curious to hear. I met first. I'd be like, how did you end up in Nairobi?
Oh, I had a sabbatical coming. I was on the faculty of the University of Massachusetts Medical School for many years, and I had our children were then very young, and so my wife Nancy and I put it off for a number of years, and then in the fall of 1987, we went over to Nairobi with our children, then age 11 and 8, which was an incredible experience. We planned to stay for 1 year. We ended up staying for 2. And I worked for the first year mainly on occupational environmental issues, mainly pesticide poisoning. And the second year, I worked largely on AIDS prevention, and I also did some work for the Carter Center, the Carter Presidential Center. And so that was a incredible experience. But going back to your question about development and how that relates to war, I think of development in terms of a major set of activities that helps to prevent war and to promote peace. And there are at least 3 ways I was thinking of that in which development reduces the likelihood of war, or if violence does break out, it makes it more likely that it will be contained, and limited in some way. One is that development builds understanding among people within a country. It builds understanding, it builds trust, so that disputes are often settled without violence, and there's a culture of settling disputes nonviolently. So I think that's one major way. The second way is that development often addresses many of the underlying factors that in turn might lead to violence or indeed to war or civil war. And they do that. Development does that by strengthening government and by strengthening civil society, by strengthening the rich fabric of non-governmental organizations that we take for granted in this country, because it's part of the fabric of life. And increasingly, it's part of the fabric of life in countries like Kenya. And I think a lot of the improvement in health, for example, public health, longer life expectancy, less infant mortality, a better women's health and so forth in countries like Kenya is because of development and strengthening not only government and making it more responsible to the public's needs, but also strengthening that rich fabric of non-governmental organizations, faith-based organizations, civic groups, youth organizations, sports organizations. All this brings people together so that ideally violence is unthinkable among people who are working together, playing together, literally breaking bread together. The other thing is, as part of that is that this work on development addresses poverty, it addresses socioeconomic inequities, it addresses animosity among ethnic and religious and other groups who might be at each other's throats were it not for development activities. And the third way, and maybe more generally, is that development promotes human rights. It promotes the rule of law. It promotes democracy. And even we shouldn't in the United States be thinking of imposing our way of democracy on other countries. But whatever you call the form of government, ideally governments should be responsive to the needs of their people and their citizens and others living within their countries. And so that means respecting human rights, respecting women's rights and children's rights, the rights of refugees, the rights of, if war were to break out, the rights of prisoners of war and so forth. So I think development has a lot of positive things that it brings about positive benefits that help to prevent war.
It's fascinating. I never thought about that correlation.
Yeah, I'm going to steal some of your language, Bear.
Oh, no, please, I don't have a copyright on any of this,
No, it's good. I mean, I think you just spoke really eloquently to that. And so my part of one of the things we do in this podcast that I want to do is, especially when I have like an academic like you, is I think that it feels for me fair to ask you about something you understand well, because you've spent time thinking about something a lot, that there must be some things you feel more certain about than others. And so, not to put you on the spot, but I feel like it's a little fair if someone's spent their life academically studying something, they should be able to like put a coherent thought together about something they understand well. A lot of times people are like, well, I want to say that I know that I don't understand something very well. So I'm not trapping you in this like absolute thing, but I'm curious what that brings up for you.
Yeah. Well, let me split my answer into two parts. There are some things that, as I said earlier, a lot of my work is in the field of occupational environmental medicine. And I think there are some things that are very clear in terms of established by scientific fact, by epidemiological studies, by prevention approaches that serve to reduce the occurrence of death and illness and injury, as a result of those interventions. I think when we get to talking about the issues we're talking about today, war and development and ways in which human rights are violated during war, and the kinds of things that need to be done to prevent war and promote peace. I think now we're getting into an area where that is so complex, and there are so many different forces and influences operating that I'm humble in saying anything like, this is something I fully understand. I understand the war in Ukraine. I know why the Russians invaded, and I know why they're acting like they are. And I have to plead ignorance. And the more I think, the more questions I try to answer, the more questions I realize that there exist. Okay. Yeah. Let me just give you an example. One of the things I've done some work on is climate change. Okay. And so I've naturally thought about the relationship between climate change and war. So on the one hand, war, particularly if it's conducted the way it's being conducted now, with heavy armored vehicles that use fossil fuels that are being used on a large scale, war is at least contributing to climate change, not to even mention all the other environmental devastation that's taking place. Okay. Yeah. So on the one hand, war contributes to climate change. On the other hand, climate change can cause war. Okay. Not necessarily on the other hand, but it's another thing that's going on, adding to the complexity. Okay. So for example, the civil war in Syria came about in part, not totally, of course, but in part because there was a 4-year drought prior to the war that led to 1 million farmers and their families going from rural areas to the large cities. There was already political and social instability in these large cities, and this added to the political and ethnic and so forth instability, economic instability that was taking place. It didn't alone cause the war, but it was one factor that led to the war. And others have reported on this. I'm not the only one who said this. Okay. And then just yesterday, adding to this complexity of the interrelationship between climate change and war, two things that I think I know something about, but really I know very little, okay, is the fact that the sanctions, on Russian oil is actually accelerating the shift to renewables like solar and wind, because Western European countries, and for that matter, the United States as well, does not want to be dependent certainly on Russian oil, and I think there's only 4% of Russian oil or natural gas that comes into this country. But so the war, if there's any benefit from the war, and it's hard to even put the term war and benefit in the same sentence, but if there's any benefit, it's accelerating the shift. It seems to be potentially accelerating the shift to renewables, and even that I'm not so sure of. Okay, maybe and so forth. So in answer to your question, I think, and I think it's true with a lot of people in academia and people who work in direct humanitarian relief and so forth. Just when we begin to think that we understand something, we realize that there's so much more to understand. And the other reality, and both of you know this as well, given the work of Global Partners for Development, is that we sit here in an office in the United States or in an educational institution, however well learned or experienced we think we are. It's the people on the ground who are living those situations day in and day out who know much more about it than we do. And in fact, one of the things that I love about Global Partners for Development, and by the way, this is not scripted, okay? We're going to cover this. No, in all seriousness, one of the things that really attracts me to Global Partners for Development is the fact that it relies so much on local perception of what the needs are, and supporting, and not telling people what you need, but asking people, what do you need and how can we support you in the ways that you think you need the support? So I think that's an important realization, for any of us who think that we know something. I think, one of the real dangers in the issues we're talking about are the people who, think they know something and understand something, and in fact they they may understand a piece of it and understand that piece very, very well, but it's only a piece.
Yeah.
So
And with all like the bad news and even just the title of your book, like From Horror to Hope, can you leave us with some hope? What is the hope? What is the hope you see after all you've seen and all the dark and horrible things you're saying? Where's the hope?
So a couple of things. So I started writing this book in the middle of 2020, in the middle of the lockdown. Okay,
Yeah.
this was my project. Oh, wow. And so I was reading about all these horrors that are reflected in the book, and I said, there has to be some positive things. Both, no one's going to want to read this if it's only about horror, and and I myself are getting a little bit depressed by reading about all these terrible things. And then I started reading about things, some very positive things that were happening in terms of wars that did not break out, disputes that were settled because of understanding and cooperation. By the way, there are over 250 rivers in the world that are shared by more than one country, shared by 2 or more countries. There could be many wars over those rivers, and yet most of those disputes over who controls the border have been settled without violence. Okay, there've been threats of violence, but most of them have been settled without violence. So that's a success story. There's more and more protection of human rights. There have been success stories in some treaties that have worked. We know about the chemical weapons that have been used in Syria, but in fact, the vast majority of chemical weapons in the world have now been destroyed. In fact, almost all of the US stockpile of chemical weapons. That's a big success story. Yeah. The landmine story, and I know Russians have deployed thousands of landmines in Ukraine, and landmines have been used in many other, and some other wars recently. Nevertheless, the landmine treaty, which was developed by non-governmental organizations 25 years ago, is a very big success story. So that's a reason for hope. Improved and more systematic humanitarian assistance is a reason for hope. And as I outline in the book, I actually have profiles of 18 individuals in the book who are inspiring people who are doing things to prevent war and reduce the impact of war. I'll just give you one example. There's a obstetrician gynecologist in the Democratic Republic of Congo, a country that's been at war for much of the last 25, 30 years. He was treating more and more women, dozens and then hundreds and then thousands of women who had physical injuries as a result of being raped, often gang rapes, and often with the intent to cause physical damage in many ways. So he surgically repaired many of those women. He started then setting up a program to address their psychological needs. He then set up a program to address their socioeconomic needs and help to train them and reintegrate them back into their communities where they were often shunned by their own families and communities because they had been raped. And then he became an advocate for the prevention of gender-based, that is sexual violence against women. And in fact, he shared the Nobel Peace Prize in 2018 for his work on advocacy. I get goosebumps talking about this, okay? But and now that's just one example. I mentioned Vincent Jacopino a moment ago, who was involved in treating people who had been tortured, and then developed what became a United Nations protocol for systematically documenting those instances of cruel and inhuman punishment and torture. There's a woman I describe in the book who's an anesthesiologist who for years wanted to work with Doctors Without Borders, and her working situation never allowed her to do that. And then she took the initiative to change her employer, worked at a place where she could take 4 months of the year off every year and have other people cover for her. And she went off to dozens, literally dozens of mainly middle and low income countries that were at war over the next 20 years, and provided not only anesthesia support, but other kinds of medical care in places where there were great needs, and actually began then to be a leader within that organization, within Doctors Without Borders, Médecins Sans Frontières. And so there are many instances of inspiring people.
Something that I just like with all these examples you were giving us, which I think is great that we were, kind of ending on a high note. It reminds me of something Mr. Rogers says, look for the helpers. And to me, that just like completely reminded me of that. Is like when all these bad things happen, look for the helpers. And that, if anything, that's just like a way to help, cope with all of the horror going. Because I honestly believe there's more good than bad in this world.
I have a lot of reason to be hopeful. I mean, I think I got through my 4 examples.
Yeah. So one thing we always end with is, what is a project you're working on right now that you're particularly excited about?
I'm particularly excited about using my book as a vehicle or as a platform to get the message out on what we've been talking about over the last half hour or so. That is that the health professionals, but the public at large, needs to have a broader understanding of the impact of war on not only on health, but also on human rights and the environment, number one.
Mm-hmm.
Number two, that these impacts can be reduced. And people have roles to play in helping to reduce those impacts. But even more importantly, I would like everyone to be more engaged in measures that can be taken that each of us can do to not only minimize the impacts of war, but to help prevent war itself and to promote peace.
Mm-hmm.
For some people, that may mean helping a refugee family in their community. For some people, it may mean having somebody talk about these issues at their church or synagogue or mosque or other religious organization. Some of this might mean having discussions in other forums in the community, in other organizations and businesses about war and what it costs us as a society, as a global society. Earlier, I said I have enormous respect for our military, and they're taking nothing away from that. We spend over $700 billion in this country of our government money for military protection, which is more than 11 times the next, more than the next 11 countries put together combined.
Wow.
Okay. Russia, China, England, France, Italy, add them all up, we're still greater than the next 11 countries. Okay, so
Wow.
We need to have an ongoing discussion about how we set priorities in this country in terms of defense, but also some of the most important defense, some of our greatest security is the health of our population, and for that matter, the population of other countries around the world. There's likely to be less instability in the world. Going back to what we were talking about before, if there's more development, if there's more aid to support countries in what they're trying to do to improve their government, to address poverty, to address inequities, and so forth. So, so what I'm passionate about, and I guess you can feel in my voice over the last half hour, is I'm passionate about these issues because something I do know about is that I think we could do better in preventing war and promoting peace. That's something I know. Okay, I don't have all the answers about how we do that, but I know we can do better. I mean, there's so many things that we as a nation do, and as individuals, communities, and we as a global society do, that are incredible. And I'm confident that we can do better in preventing war and promoting peace. Maybe at some point to have a world without war. I know that's an idealistic vision. I know that seems impossible when they're in the midst of this, and there's 13,000 nuclear weapons that we haven't even talked about today that represent an existential threat and so forth. But that's what I'm passionate about.
Thank you, Dr. Levy. That is hopeful. I love that you are optimistic. From someone who knows so much, that you are optimistic and that you have hope that we can do it. Thank you so much for joining us today. This was such an enlightening conversation that I think so many people need to hear.
Thank you so much. Great to be with you.
At Global Partners for Development, our mission is to advance community-led initiatives that improve education and public health in East Africa. We envision a world in which every East African community has the capacity to implement dynamic, sustainable solutions to the challenges they face. To learn more, visit gpfd.org.